Hello, I'm here with Dr. Melhem Solh, an expert in diffuse large B-cell lymphoma, or DLBCL. In this video, we'll discuss the responses seen in LOTIS-2, the Zynlonta registrational trial. Dr. Solh, before we get into response rates, why don't you briefly remind us of the LOTIS-2 study design and patient population?
Yes, I'd like to touch on that information because it provides important context for the study results. LOTIS-2 was a large, open-label, single-arm phase 2 study. It included 145 adult patients with a relapsed or refractory diffuse large B-cell lymphoma who had received 2 or more prior systemic therapies. Zynlonta was administered as monotherapy in a 30-minute outpatient infusion every 3 weeks. This treatment was continued until progressive disease or unacceptable toxicity for up to 1 year. The primary endpoint of the study was overall response rate, but the main key secondary endpoints were duration of response and complete response. LOTIS-2 included a broad range of heavily pretreated patients with difficult-to-treat disease, as outlined here.
Thank you for the reminder of those important details. With that context in mind, let's discuss the results.
Sure. So the data cutoff date for LOTIS-2 was April 6, 2020. Patients had been followed for a median of 7.3 months, and the range was anywhere from 0.3 to 20.2 months. By the cutoff date, nearly half of LOTIS-2 patients, and to be very specific, 48.3%, achieved a meaningful response with Zynlonta as a single-agent therapy. Half of those patients who responded, or 24.1% of all study patients, achieved a complete response, and half achieved a partial response. Importantly, not only did many patients achieve a response, but the median time to response was rapid, 1.3 months for the overall response. The median time to a complete response was 1.4 months. So by the first imaging assessment, which was performed approximately 6 weeks into treatment, a substantial number of patients who responded to Zynlonta had already done so.
And how long did those responses last?
At the time of the data cutoff, the median duration of overall response was 10.3 months, and the median duration of complete response was 13.4 months.
Thank you. Is there anything you'd like to add about the responses seen in the trial?
I'd just like to emphasize that it's extremely important to consider the responses in this patient population, as we discussed, because most of these patients were heavily pretreated and had distinct treatment challenges. As we're addressing the types of patients included in LOTIS-2, we can actually dig deeper into the response rates. The study investigators analyzed the response data by patient subgroup. This can be very helpful when physicians are making clinical decisions about their own patients. Now, bear in mind that these were exploratory analyses or predefined subgroups. The study was not powered to demonstrate an effect in patient subgroups, and the sample sizes were small. That being said, responses were seen in trial participants regardless of age, disease subtype, level of refractoriness, number of prior lines of therapy, or treatment history. This includes patients who had prior CAR T-cell therapy, had prior stem cell transplant, or were refractory to all prior therapies. A pervasive unmet clinical need remains for patients who are ineligible for or who relapse after stem cell transplant or CAR T-cell therapy. The fact that responses with Zynlonta were seen among these patients should not go unnoticed. And remember, these responses were observed with a single-agent infusion only once every 3 weeks.
Thanks for such a detailed review. I'm sure our viewers appreciate seeing the responses by patient subgroup. Now, I understand all the responses you just described were from the primary analysis, and a follow-up analysis was performed?
Yes. The data cutoff date for primary analysis was April of 2020. The follow-up analysis extended to March of 2021. This allowed us a median follow-up time of 7.8 months, whereas the median follow-up time for the primary analysis was 7.3 months. If you recall, the overall response rate was the primary endpoint of the study. In the follow-up analysis, overall response rate had not changed from the original. It remained at 48.3%. There were slight variations to the complete remission and partial remission rates. One additional patient had achieved a complete remission, which increased the CR rate from 24.1% to 24.8%. So the PR rate decreased slightly from 24.1% to 23.4%.
Interesting. Did the follow-up analysis evaluate duration of response?
Indeed, it did. If you recall from the primary analysis we mentioned earlier, median duration of overall response to Zynlonta had been 10.3 months. With the additional follow-up time, that median increased to 13.4 months. For complete remissions achieved, the median duration of response from the primary analysis had been 13.4 months. With the additional follow-up time, the median for complete remissions was not reached.
Were any new safety concerns identified in the follow-up analysis?
At the time of follow-up, no new safety concerns had been reported.
I'm glad to hear that. Thanks so much for addressing the follow-up analysis. I have one more question. Did any of the trial participants with disease progression receive subsequent treatment?
Yes, actually some patients went on to receive other anti-cancer therapy after Zynlonta, including 15 patients who received CAR T-cell therapy and 9 patients who went on to receive a transplant. The clinical outcomes for those patients have not been confirmed in a randomized clinical trial.
Dr. Solh, thanks so much for sharing your time and expertise in this area. We hope you found this discussion informative. To see more of our discussion, please watch the other videos available in the series. For additional information, you can visit ZynlontaHCP.com or contact your ADC Therapeutic sales representative. Now, please take a moment to view the important safety information for Zynlonta.